There are global challenges. Take antibiotic resistance, for instance, which we cannot solve alone in Sweden. It's a global issue.
It is not my problem. Somebody else will deal with it. So I no longer think like that.
It's a few materials here and few instruments, but it was a good way to learn how to solve problems.
Actually, we need to innovate and always think about the bigger picture.
4 out of 5 continents have aging populations, and it's only Africa that will have a young population. But how can we actually invest in these young people? 25 years ago, I would drive to the center of town, but these days I can easily spend an hour and a half getting to work and an hour and a half home. Quality of the air is also very bad. So on some days, central Kampala has very bad air and smog now. So it does affect you, both in terms of how you can work, but also on the quality of the life.
I first came 25 years ago. People don't necessarily see me as the big professor. I grew up in a small village in Sweden, so I wanted to get into society and see if I could contribute. I think I have more interesting and better scientific discussions here than I do in Sweden, where we publish very nicely, but we rarely get to the so what. Here it's the so what to begin with. And we live in very different circumstances. In Sweden, I can trust my municipality, but here it's very different. It's up to you and your family. Are you putting your children in a good school? How are you going to support yourself when you retire? That's where things get a bit different.
In Sweden, it's so commonplace for everyone to go to the dentist every 2 years. You know, the government pays part of dental examinations and part of treatments, so dental care is more taken for granted.
It's a few materials here and few instruments, but it was a good way to learn how to solve problems.
In Sweden, you change gloves maybe 10 times for every patient. But here, I've learned the technique of taking off a glove and then putting it back on again. You inflate it like this.
You know, I think for all students, if you can travel and see something different, a different context, Ugandan students going to Sweden, students from Sweden going to Uganda, it gives you a different perspective on what things can be like.
And also, you know, the intercultural exchange, seeing how you guys see the world. You guys seeing how we see the world.
You didn't get the culture shock, did you?
No. I think I will get reverse culture shock when I come back. I will sit next to someone on the bus. They will start crying.
I've been working primarily with Uganda for 25 years. Dels har vi en sån här gammal tradition ända sedan Martin Luther att vi spikar upp avhandlingen här för public examination. Och sen om man lyckas, då hamnar man på väggen här. Det här var min mentor, vad står det? 1990. Det är 35 år sedan. Men om man ser liksom vad det blir av människor, många av mina doktorander hänger på väggarna här, de har liksom ganska stora jobb.
We're doing something unique because we're modeling an equitable partnership and doing that with such warm and welcoming collaborators. So I'm privileged.
Mish was a changing step, something that changed my life really, because we have this belief of saying it is not my problem, somebody else will deal with it. So I no longer think like that. Every time I see a problem, I will think, what is the solution? Can we deal with it? And then I immediately approach the people responsible. I actually always have solutions.
Mich taught us to collaborate, especially during the assignments, but also through different projects, and also learning that you actually don't need so many resources to start innovating. Many places, many countries face similar problems, and solutions that were shared during our cultural exchange and interactions can be transferred. So it became a big realization that actually we need to innovate and always think about the bigger picture, which is how we achieve the Sustainable Development Goals for improvement of health and well-being of all people.
What Sweden can learn from Uganda?
Making the most of small resources, I think, is what we can learn generally from Uganda. Now we're on my home stretch, and I'm stopping off to buy some fruit on the way. Fresh fruit is definitely something that Uganda offers. Now, something that has also changed is the readiness to work from home several days per week, because we're always in traffic jams. For once, when I attended Makerere graduation, even I could be colorful.
The most fundamental right to me is choosing your pregnancy, surviving your pregnancy, and having your baby survive. And I think as we now discuss in our partnership and also with the Swedish Embassy, what can be done in the area of sexual and reproductive health and rights is to reduce teenage pregnancy. Then is the issue of delivery care, where midwives actually has shown that if you empower the midwives to talk with expecting mothers, how would you like to deliver, it has very positive outcomes, both for the mother and the baby. And actually, if I look at my area of research, child health, the under 5 mortality rate has gone down by 2/3 during these 25 years. Then Professor Stefan Swartling Peterson's example of developing mobile phone stroke rehabilitation, validating it here and then bringing it back to Sweden is an example where we can have two perspectives of it.
And you know, we do the same project in Sweden, so we can compare how it is to have a stroke in Uganda and how it is to have a stroke in Sweden.
And if I look at the future, 4 out of 5 continents have aging populations, and it's only Africa that will have a young population. But how can we actually invest in these young people so that they become healthy, they become educated, they become employable, or they can create their own job? Now you can learn everything everywhere. Here we are, UNICEF Digital Hub for Young Change Makers. Doesn't that sound attractive?
Fundamentally, I think people are the same whether we're in Sweden and Uganda. We want the best for our families and ourselves. And I think in these days where we want to be so transactional, what's in it for me, what's in it for my country, we need to remind ourselves about the human rights. Leaving some people and some regions behind is not an option.